A 20-year-old woman presented with a right forehead degloving injury sustained in a motor vehicle accident, and after initial stabilization, the plastic surgery team was consulted for reconstruction. Initial laboratory results and CT scans showed no additional injury. After 2 initial debridements, the patient was left with a 5x4 cm full-thickness soft tissue defect with exposed frontal bone. So the problem list includes a right forehead degloving injury in an otherwise healthy 20-year-old woman, a 5x4 cm full-thickness soft tissue defect with exposed frontal bone in a cosmetically sensitive area, and the need to maximize aesthetic results while minimizing morbidity. How would you face the case? Option A, flap reconstruction and local tissue rearrangement. Option B, wound healing by secondary intention, followed by full-thickness skin grafting.
The votes are in, and you chose A.
Hello, I am Dr. Amaka Patricia Ehighibe, a plastic surgeon from the Federal Medical Center Jabi in Abuja, Nigeria. I want to thank Dr. Ramly for inviting me to collaborate on today's episode of PRS Go Face the Case. Today's case is a 20-year-old lady who sustained an avulsion injury to the right side of her forehead following a road traffic accident. I do agree with the author's choice of management of this case, in as much as both options preferred are very reasonable options for managing this avulsion injury. I prefer the author's choice for several reasons. 1. A local tissue rearrangement may have the potential to pull the eyebrow out of alignment, and in a bid for this not to happen, there may be a tendency to close the wound under tension, which eventually will not pan out well. Secondly, this injury happened in a low and middle income country where health insurance is not very robust for the general population. So this conservative mode of treatment, which required minimal funds and the patient could manage the wounds on their own on outpatient basis, I think was a very bright idea. I would do the same for a case like this. The only things I would have done differently would have been to bore a few holes after my debridement in the outer skull bone to encourage faster granulation tissue and use a negative pressure wound therapy machine. Usually this will reduce my treatment time to about 2 weeks, and then I could slap on a full thickness skin graft. I encourage you all to look out for more cases on PRS Global Open Face the Case series. Thank you for watching.